For the diverse needs of our patients, we offer access to multiple excimer laser technologies. Depending on the health of your eyes, your age, and your level of refractive error and your visual requirements, Drs. Gordon Binder and Weiss have the unique capability to create a customized treatment plan for your specific lifestyle.
There are many different excimer lasers to change the shape of the eye, and each one has certain bells and whistles. Now, we have selected what we think are the two best, the Vizix Star 4 laser and our Wavelight Allegretto laser. And the reason we've selected them is that each one does something a little bit different than the other one does. So for patients, for instance, that have large pupils, I'll use the Wavelight Allegretto laser. For patients who need to have custom surgery for farsightedness and astigmatism, I might use the Vizix laser. Small pupil people with lots of astigmatism, I might use the Vizix laser. So we can pick and choose what's going to be best. And this combination of these two lasers is as good as you can get currently compared to any other laser combination.
LASIK is a two-step process that begins with the making of a thin protective flap in the outer layer of the cornea. To reduce possible risks and side effects associated with this portion of the procedure, our surgeons use the latest generation of a femtosecond laser called Intralace. With no blades or cutting involved, Intralace offers surgeons more precision and accuracy while offering patients unsurpassed safety and superior results.
LASIK stands for Laser Assisted In Situ Keratomileusis. You're using a laser to change or grind the cornea. That's what keratomileusis is. And in general, what you do is you take the top 20% of the cornea and it's folded back to the side. The remaining corneal tissue is treated with a laser beam that changes the shape of that tissue. That change in shape is what determines the prescription change. If you remove a concave shape, then when you put the cornea back, it tends to flatten a little bit to correct myopia. If you treat it with a donut shape where the center isn't treated but the periphery is, when you put the cornea back, it goes on steeper. And if you make it egg-shaped for either of those two shapes, you correct astigmatism. When refractive surgery was first developed, an instrument called a microkeratome was used to lift up that top 20% of the cornea. And that utilized a blade, a razor blade fragment that was oscillated back and forth several thousand times per minute to create the flap. And they worked out pretty good. But there were risks with the blade. There were problems with the quality of the blade system. In 1999, the first sighted procedure done with a laser to create the flap was performed by a company called Intralace. In 2002, we recognized this technology was going to have many of the benefits and decrease the risks associated with the bladed technology, so we purchased the Intralace. Well, when we got the Intralace in 2002, it only took 2 or 3 cases for me to realize this was superior to what we had. I mean, it's like going from a 1950s car to a 2005 car. You saw it right away. Then we started studying the results, and I looked at my own results because I capture all this data in a database and analyze it, and I saw immediately that the predictability of the dimensions of the flap was much better with the Intralace. And then studies by myself and 3 other published studies done with the old mechanical microkeratome in one eye and the Intralace in the other eye clearly have demonstrated more eyes seeing 20/20 or better, more eyes closer to a 0 prescription in these controlled studies. So what the Intralace offers is increased safety. All the side effects that can occur with a bladed microkeratome are eliminated immediately. And you get better outcomes, faster recovery of vision, more predictable results. I mean, it's just increased the predictability, safety, and outcomes way ahead of what a mechanical microkeratome can do.
For patients who are not ideal candidates for LASIK, our surgeons offer a procedure known as PRK, a proven, safe, and effective alternative to LASIK.
Surgeons were doing PRK prior to LASIK, and then we started doing LASIK, and LASIK kind of took over as the predominant procedure. Now we're going back to doing more PRK for various reasons. Sometimes for the safety because of the thickness of the cornea, sometimes because of aberrations on the cornea to get a better result. The results with PRK are just as good or sometimes better. The only difference is there's somewhat of a slower rehabilitation time, but the outcomes a month, 2, 3 months down the road are just as good or, as I said, sometimes better.
We are doing more PRK, and I think one of the reasons is we're tending to be a little bit more conservative because some of the potential risks of LASIK we have learned over the last years. So, you know, for us, any individual, and in the multiple screening tests that we perform, If there is a certain risk factor, when we do the screening for LASIK, we'll do PRK because we know PRK, you're going to get an optically either similar or actually in a lot of cases an optically superior result than LASIK. The only difference is the wow factor. LASIK has a big wow factor. In other words, you have your surgery today, you have both eyes done, you have very little if any discomfort. Next day you're seeing 20/20, you go to work. PRK, you don't have that. There is a little bit of discomfort, because we're removing the cells that cover the surface of the cornea. Those cells have to grow back, which takes about 3 or 4 days. During that time, you'll see to get around, but you're not going to want to work. You may be a little bit uncomfortable, you may be a little sensitive to light, so you definitely don't have the wow factor. But down the line, 1 week, 2 weeks, 3 weeks, a month, 10 years down the line, that's going to be as good or maybe even better than LASIK.
To help patients with presbyopia reduce their dependency on reading glasses and bifocals, our surgeons perform a non-laser procedure known as near vision CK that uses radio frequency energy to improve your near vision.
Presbyopia is the condition of the eye as we get older, and it does happen to everyone, where you lose your ability to actively focus your eye, which means you can't see things up close. And that's something that's progressive, and it's something that gets worse as you get older. The demographics now of the baby boomer population, which is, we all kind of fit into, at least I do, is a lot of us have had laser vision correction 5, 10 years ago, and we were very, very happy. Now all of a sudden, we're still happy with our distance vision, but we can't read. In other words, go to a restaurant, you're looking for reading glasses, you're borrowing them from the maitre d', it just doesn't work. So we have lots of people now in because the demographics of the population have shifted, where the baby boomers now are doing great at distance because they either naturally were good at distance or they had it fixed, but now they want something they want to fix for the reading vision. One of the best procedures we have now, and actually the first procedure that was ever approved for just to improve your reading vision, is CK, or conductive keratoplasty. And the way CK works, it's radio frequency energy that's applied to various spots on the cornea to literally tighten the protein in the cornea and thereby change the shape of the cornea. And the beauty of it is there's no cutting, there's no tissue removal. It's the safest thing we do in ophthalmology. And it gives you a monovision, meaning it gives you kind of the one eye that's kind of for reading and one eye for distance. That's the best monovision profile of any monovision we do, be it contact lenses or LASIK.